in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon se, Samvad Sarokar News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topic. And today we are taking a very, very unique topic, and the topic is women and beauty. True beauty lies in the purity of the heart, said Father of the Nation, Mahatma Gandhi. Nothing makes a woman more beautiful than the belief that she is beautiful. The true beauty in a woman is reflected in her soul. It is said beauty is only skin deep. Outer appearance do matter, but they are second to a beautiful soul. When a woman has a beautiful soul, she is truly beautiful. The idea of beauty and woman together is beyond time. Women go to endless lengths to display their beauty through their hairstyles, makeup, fashions, and accessories, and even as far as cosmetic surgery. There is no bound to what women will do, including pampering themselves with cosmetics and treatment to make themselves look more beautiful. Many women will think of outward appearances first when thinking their beauty. Nevertheless, they rarely consider the internal facet of their beauty. A woman's identity is part of her inner strength and beauty in association with her lifestyle. You may meet a woman who is only average outwardly, but has an inner personality that shines through as soon as she speaks. Her state of beauty emanates from a reserved or unruffled inner self-assurance that clearly outshines her outward appearance. She will know who she is and her place in life. This type of woman may not have the looks or figure or a top model or big name, but this becomes well noticed when her inner beauty becomes clear. It would be much comprehended if the media and fashion industry were able to post more accent on the inner aspects of women's beauty and not concentrate so much on outward appearance. If women used less external means of enhancing their beauty and tried to increase their inner beauty through individuality changes, they would be more attractive. The inner beauty of a woman should always be stronger than her external appearance. An inwardly beautiful woman possesses properties of honesty, integrity, and a good moral code. A woman that has a high inner authority and is sure who she is will be able to acquit herself well in whatsoever circumstances she finds herself. Many of the characteristics that contributes towards a woman's inner beauty come from life's experiences and can take time to amass, although there are exceptions to this. A woman's lifestyle contributes to the other side of inner beauty, inner health. A woman's hair and skin signal whether she has a untainted lifestyle or not. Diet is a key factor in the appearance of beauty. A diet consisting of the right balance between protein and carbohydrate is all important to a woman's beauty. The healing effect of a beneficial night's sleep cannot be overemphasized. You need to have a calm mind before retiring for your night's sleep. Try a warm bath with soothing music. Although women may have outstanding inner beauty, she will still need to maintain and contribute to her external beauty. Beauty ideas and help may be found on the web, in magazine, or on the television. But today we have those who are dealing with this women's beauty, and they are with us today, and they are going to share their thoughts about the women and beauty. And our panel today is a very, very highly talented, experienced, learned, who are authority in their field. So I would like to invite my first guest. He is Dr. Rajivanan. Dr. Rajivanan is a senior psychiatrist and marriage counselor. Dr. Rajiv Anand passed his MBBS in 1976 and did MD in psychiatry in 1980 from King's George Medical College, Lucknow. He opted to serve his country when it was very common to settle abroad for brighter future. He has been serving society with his base in Mumbai. He has clients all over India as well as in many other countries. He was honored with Lifetime Achievement Award by AMA. He has conducted more than 3,000 workshops for different groups and companies with audience size of 10 to 800. His television program on various channels have been widely appreciated for his forthright and practical approach. He is leading in the field of mental and emotional well-being for 40 years. He was president of IMA for 2 times. He was interviewed in several talk shows in domestic and internationally. Welcome, Dr. Rajivanan, on our show. Dr. Rajivanan, as you know, today's topic is different what we used to discuss every time. And today's topic is women and beauty. But you being a senior psychiatrist as well as a marriage counselor, you are coming across all types of your clients, or I will say fellow countrymen, coming with different mental problems, including when the husband expect some more beautiful girl as a bride, or the bride also expects something from the husband. So there are beauty is whatsoever we will say that external beauty is not required, but the practical approach or the fact of the life is that we also believe in the external beauty. And that is why we always have a contest, beauty contest. We never have a ugly contest or a inner beauty contest. We have a external beauty contest. Although nowadays they are asking the question on the social aspects, social service, etc. But the inner beauty, which are very much there in almost, I may say that all women are having God gifted the inner beauty that we are not exploring at all. But you being a psychiatrist, you know the conditions, the mental condition of women as well as men. So we would like to know from you your views on women and beauty. Dr. Rajivanan, please.
Yes. Good morning, Mr. Lal, and good morning, my fellow panelists. And after a long time, we are having 4 great ladies on the show. Dr. Neeta, welcome. Dr. Shama, Dr. Chama, Dr. Pallavi, all expert in the field of the beauty. And me and Mr. Lal, only 2 men, we have to learn a lot from you. At the outset, let me clarify a few things. Beauty is... Let me welcome all my fellow panelists if my voice was not audible earlier. And let me clarify one concept. The beauty had been conventionally or rather popularly being, maybe this popular concept of beauty had been left by world over by most people in the mass society, which is erroneous. Fortunately and luckily, women's beauty is not confined to face and her body only. No. The face and the body just represent 10% aspect, external aspect of women's beauty, which is visible or which is tangible, in which there are experts, all the beauty parlors, all the hairdressers, all the hair designers, and all the great cosmetic surgeons and cosmetic dermatologists, with all due respect to them, have achieved great things in the last 2, 3, 4 decades. But that is confined to 10% aspect of the woman's beauty, which is external, which is visible, and which is tangible, which can be photographed, which can be seen, which can be flashed across the magazine covers. The 90% aspect of woman's beauty is with her personality. I would take you back to your memory of your childhood. Can you say your mother or grandmother was not beautiful? They were. How many cosmetics did they use? Perhaps talcum powder was the best luxury, or Afghan snow cream was the biggest luxury, yet they were beautiful. Can anyone of us say that we ever had thought in our mind that my mother or my grandmother is not beautiful, or someone else's grandmother or mother is more beautiful? No. The point I'm driving over here, that over last 5-6 decades, we have deviated a lot from the concept of 10% external beauty versus 90% internal beauty. If the 90% inside personality is well founded, well organized, and well nourished, then the 10% would also be taken care of very naturally, very spontaneously. While if the 90% would be neglected, and what I mean by word neglect, I would come to it in a minute from now. If the 90% would be neglected, not cared, not nourished, then 10% of the external level may not suffice. That's why we all find mushrooming of the beauty parlor. Somewhere the charge is 3,000, 5,000, 10,000. And how long does that last effect of that procedure? May last 12 hours to 24 hours, or best of even hair designing, or best of cosmetics, which wears off or which has to be taken off in a matter of half a day or maximum 1 day. Well, the internal beauty, which most of the women in our society did have, not only did have, even now have, that has no connection with the cosmetics. That has no connection with any hairdresser or any beauty parlor. Do we think that if we go to Arunachal, or we go to Meghalaya, or we go to other places like this, natural places, hill stations, or interiors, or closer to the hill, can we see that we would see many beauty parlors, many hair designer? Possibly no. Can we say that people in those areas where many of us have gone, are the women not beautiful? They are no less than beautiful than any girl in the city. Where does that difference matter? How come they are very naturally, very admiringly beautiful, with minimum of the cosmetics? If we go back to Kerala, if we go back to interiors of Tamil Nadu, are women not beautiful? They are beautiful, because there is different kind of aura, different kind of balance, different kind of inner control they have developed. They are closer to nature, part one. I would repeat and I would summarize: they're closer to nature, part one. The urban women have gone far away from nature, so they are losing beauty. The traditional women who had ample beauty, they were closer to the family, where the emotional nourishment happened. The urban woman, fortunately, unfortunately, willy-nilly has gone away from the family or from the near and dear ones. So she's not getting a soul nourished. Then traditional Indian women worked for the nourishment of the family, interacted in a very healthy way, felt reasonably secure. The marriage was not ever in any kind of threat, and she was having good bonds with everybody in the family, be it father-in-law or husband or brother-in-law or son-in-law or other members of the family. While today's woman is lonelier. She does not feel bonded. She does not feel jailed. So always she's carrying insecurity of tomorrow because she's lonely. She's not emotionally nourished. I would also like to draw the attention of lakhs of people who are viewing this program in a very brief way. Let me say, these days, almost everybody and many women are using the word but, B-U-T, but very, very often. And in reality, this is not but, B-U-T, this is cut, C-U. More women use but, they have greater degree of emotional turbulence inside because they are using cut. So please listen next few words. Words beginning with C, cut. Comparison is the biggest poison which takes away their beauty. They are not happy. They are not content what they have, the eyes or the face or the hair or whatever they have. They are always disturbed, always insecure about what others do have. So comparison is another. Comparison, counting my height, her height, counting, calculating, comparing. The need to control is another thing which takes away their beauty. And everything they comment, everything they criticize, this has become a popular fashion these days, to comment, criticize everything, to control everyone around. All these C's together, and women also are developing a tendency to change their husband, change their man, change the boyfriend, change the family members. Now, all these things have
Beauty is commonly described as a feature of objects that makes these objects pleasurable to perceive. It is often listed as one of the three fundamental concepts of human understanding besides truth and goodness. The word beauty is often used as a countable noun to describe a beautiful woman. And okay, now I'm inviting my next panelist, and she's Dr. Pallavi Rati. Dr. Pallavi Rati is MD, DDV, FCPS. She is the consultant dermatologist, cosmetologist, trichologist, and laser surgeon at Mumbai. She is medical director of My Skin, My Health. She is a celebrity dermatocosmetologist. After completion of her MS, she did her fellowship in laser and cosmetology from Singapore. She has been trained in many national and international conferences in the field of aesthetic medicine. She is a member of IADVL, EADV, and CSI. She has experience of more than 10 years and was associated with Kaya Skin Clinic as a senior consultant. Her many articles were published in newspapers, fashion magazines. She was awarded in 2018 as Best Dermatologist by All Ladies League Association, Mumbai. Her expertise is in dermatology, cosmetology, trichology, with experience of 12 plus years. Welcome, Dr. Pallavi Rati, on our show. Dr. Rati, you have heard not fully, but in part what Dr. Rajivanan has said. But you being a consultant of few specialties, it's very difficult for me to read all, but as you know, I have to read. Is the consultant, you are the consultant of dermatologist, cosmetologist, trichologist, and laser surgeon. Now it means you are creating, or you are making a woman more beautiful from outside. Now, we would like to know from you, the women and beauty. Dr. Pallavi Rati, please.
Yeah, thank you, Mr. Goel, for this vivid description. And let's come to the talk. Now, first, I would like to say what beauty is according to me. Beauty is the quality, how we perceive, how our senses perceive. So, being beautiful is not only external, but always it is also internal, as Mr. Anand also said. Now, being beautiful nowadays is very different from what concept we had decades ago. What happens is now beauty is something which lies in the eyes of the beholder. It is said beauty lies in the eyes of beholder. How we look at beauty is going to change from nation to nation. It is going to change from person to person. It is going to change from religion to religion and from region to region. And we need to accept this, though this is a bitter truth. But yes, today we are living in a world which is quite competitive. We are living in a world which is quite comparative, and we need to adjust ourselves. Now, coming to the how beauty should be accepted by an individual, how we should look at beauty is something wherein we have to look at from both the aspects, external as well as internal. Now, what I normally say to all of my patients as well, beauty is always interrelated. When you have an internal beauty, it is going to reflect on your external beauty. And when you have an external beauty, it is going to give you that self-confidence which is necessary. So this self-confidence will help you to boost up your inner beauty as well. Now, if we talk about inner beauty, we always look at from the aspect being kind, being careful, being loving, and all this, the good qualities what we expect, which naturally are gifted to women. So this is something which comes from the inner beauty. External beauty is something wherein we look at a good appearance. Definitely, I'm not in favor of white beauty, or I'm not in favor of color differentiation. That is not what we look at. What we look at external beauty is a healthy skin, which should be giving you a self-confidence, which should be able to make your inner talents come out. Many times I have seen people, they become shy, they don't go to media, they don't interact, they don't go to social groups or social parties just for the fear of being criticized. This is something wherein you are holding yourself, you are not allowing your inner talents to come out. So why not take advantage of the medical science to make yourself beautiful, whatever is possible and whatever is within the limits. So this is what I look at from the aspect of beauty. Now, when comes first thing, what I always tell, nothing makes a beautiful more than the belief that she is beautiful. We should all believe, all women here who are watching this show, first thing what you should inculcate in your mind, in your heart is that I am beautiful. It is very important. Tell yourself every day, I am beautiful. You don't need a certificate from your husband, from your in-laws, from your friends to understand that you are beautiful. You are beautiful. You are beautiful soul, and you have come in this world with some agenda. God has given you this life to bring something beauty, to bring some beautiful things in this world. Any woman should have that feeling of being an superior person. That is something which is important. We are the only species in the world which can carry a child. That is something which itself tells a lot of things, how nature has given us this gift, and this itself makes us more beautiful than anything else in this life. Now, coming to how beauty standards have changed. Now, initially, when it was like say around decades ago, even even if you had a good skin, a good hair, it was enough. But nowadays, what is happening is we are all fighting towards getting better and better. Now, why this is happening? This is happening because of the media. This is happening because of the social pressure. This is happening because of the availabilities of the things. If something is available, you get a choice, and then it's a demand and supply. The supply comes, the demand increases, supply increases. So this is something how beauty goes nowadays. So herein, as I said, that beauty standards vary from region to region. Now a person in the north might look at beauty as a white skin, as something wherein you have a beautiful skin, long hair.
Just a minute. I think some disturbance is coming.
No.
Dr. Rati, yes, you are there, but you please change the name in the screen, and then we will be able to take you afterwards. Yes, Dr. Rati, please go ahead.
May I?
Yeah, please go ahead.
Okay. Now, basically, I was talking about how beauty standards vary from region to region. Now, in North, the beauty standards might be different. In South, the beauty standards might be different. East and West, the beauty standards might be different. India has different beauty standards as compared to the Western world. Now, wherein Western world accepts all kind of cosmetic surgeries, all kind of invasive surgeries like Botox, fillers, threads. Indians still, we do not accept that, and we look at aging gracefully. So this is something which is going to be part and parcel, and it changes from time to time. It changes from region to region. It changes from person to person and the need of a person. We can't expect a housewife asking for something for a plastic surgery, but yes, we can expect a corporate person asking for plastic surgery because it's a demand of her job, her lifestyle. So this is something wherein beauty standards might vary, but one thing what you need to remember is everything what you incorporate is something which is going to make you beautiful. That comes with your diet, that comes with your inner feelings, that comes how confident you feel about yourself, how happy you feel about yourself. Always I tell everyone that we should nurture our hobbies. Everyone has been gifted with some unique talents by God, and we should identify those talents. We should nurture them. We should reciprocate them in society to get an appreciation to it, so that again it brings a vibe of goodness in you, and the beauty, internal beauty increases, which will always help you to reflect on your external beauty as well. So with this, I would like to conclude that be a girl with a mind, a woman with attitude, and a lady with a class. So I think that's what from my side.
Okay, thank you very much, Dr. Rathi, for giving your views. And Dr. Rathi has clearly mentioned that the beauty is changing time to time. Not the beauty is changing, rather the perception or the thinking of the people are changing. And she said one very important point she made is that in India, we still believe in the natural beauty, while from Western countries, they are going for very advanced surgeries to see that they will look more beautiful. But she says that it all depends, like how homemaker or housewife doesn't require so much surgeries or so many new things, but a corporate lady requires, because it's a demand of the job. And she says that it all depends how we see, because the beauty lies in the eyes of the beholder. So that's the view Dr. Rathi has given. So thank you very much, Dr. Rati, for giving your views.
Pleasure.
Standard of beauty have changed over time based on changing cultural values. Historically, paintings show a wide range of different standards for beauty. However, humans who are relatively young with smooth skin, well-proportioned bodies, and regular features have traditionally been considered the most beautiful throughout history. Now, I would like to invite, I will just see if she's there now. Yes, Dr. Rati, you are there, Dr. Neeta Rati?
Yes.
Okay, very good. Now, I would like to invite our next guest, and she's Dr. Neeta Rati, MBBS MS. Dr. Neeta is the renowned cosmetic gynecologist based in New Delhi. She did her MBBS and MS from GSVM Medical College, Kanpur. She worked as demonstrator with undergraduates for 1 year. Since then, she practiced as gynecologist. She went to Tripoli, Salahuddin University Hospital to teach undergraduate MBBS students. In 1997, she started doing cosmetic gynecology and skin hyperpigmentation under the brand Melblock. Melblock Center is situated at New Delhi. She is attached to American Academy of Cosmetic Surgery. She is regularly attending international conferences. Welcome, Dr. Neeta Rati, on our show. First of all, before I will ask you anything or you will start, we would like to know what is this cosmetic gynecologist? Because we have heard a gynecologist, everybody knows, because the gynecologist is the doctor who is bringing the human or this life on the earth. And that's why we know about the gynecologist. But for the first time, at least my knowledge is very limited. And I would like to know what is cosmetic gynecologist. And definitely, you have heard Dr. Rajivanan in part and Dr. Pallavi Rati also. Now, we would like to know from your views, women and beauty. Dr. Neeta Rati, please.
Yes. Thank you, Mr. Goel. I thank you for inviting me on this talk and this show. It's kind of you. Now, I am actually into practice since 40 years now. Of course, I started as a gynecologist, but in my journey of gynecology, I was seeing women who had the after effects of deliveries on their bodies. And I found that a lady, a young woman, say 22, 23 or 25, getting pregnant, delivering, and then the whole body changes. There could be hyperpigmentation on the face, there were stretch marks on the belly, and there were other changes in the body, which somehow at that time of say 1980 and 1990 and people were not too much aware of how to prevent these problems from happening. And the criteria for beauty was that women having a good face without pigmentation, at least a clear skin, the body without stretch marks, the belly not loose, the muscles tightened up. So all those things, and in that times, the family bindings and family commitments were very high. So the girls who used to undergo these things, they were bound by the in-laws, the opinion of in-laws and other things, ki tum bacche ko nahi dekh rahi, apni taraf zyada dekh rahi. So that was like a big taboo for any woman to go in for their own beauty at that time when they have already delivered. But we all know by now that the first year post-delivery for any girl, any lady is very important to revert back into its original shape. Also during pregnancy, I have learned many things which can be done to prevent the stretch marks from happening, to prevent hyperpigmentation or melasma or chloisma, which we call during pregnancy, from happening. So there are certain preventive measures which can be taken so as to let the woman have her beauty even when she is pregnant, even when she has delivered. Well, now the awareness is much better in the society, but I'm talking of those days. So when I came back from Tripoli and I was practicing here in India as a gynecologist, I met many women somehow, because I think I was destined to go into this direction. I met many women who were very upset that jab se mera delivery hui hai, my husband is looking left, right, and center. So that means that she has considered herself or the family or the husband that this lady is now no more beautiful and I can have other options. So now the plight of this women, actually, it made me look towards cosmetic gynecology. I said, if cosmetics can happen in dentistry, it can happen in skin, it can happen in many more fields, why not in gynae? So with small changes, some surgical procedures, small surgical procedures, which we used to do under tumescent local anesthesia, which the tumescent local is a special type of local, the effect can last for 12 hours. So we started doing those small procedures, and my whole life changed by one woman coming from Gorakhpur with 2 children, one 3 years and one was just 1 year old, with her half blind mother कि डॉक्टर रति प्लीज कुछ कर दीजिए कि मेरा जो है वो बॉडी इतनी अच्छी हो जाए कि मैं जैसे पहले मेरे हस्बैंड मुझे लाइक करते थे वैसे ही करें. So that incident changed my whole life, that I moved towards cosmetic gynae and I started doing. Now cosmetic gynae as it is, and then later I started practicing from 97. Later when I went to US to the American Academy of Cosmetic Surgery, I found that even they have a big program of cosmetic gynecology, and rather of the 5-day conference, 1 day was totally dedicated to cosmetic gynae. I was so pleased to know that this thing which I started on my own, it already exists in America, at least. And we have cosmetic gynecologists, especially Dr. Pelosi 1, Pelosi 2. They have a big center of cosmetic gynae in New Jersey. So we met them also, all the 3 generations into it. Now then, in cosmetic gynae, what I found that, well, corrective procedures as far as local vaginal surgeries are concerned were there. But in addition to that, I found the biggest plight was the looks. The looks. Now, any lady who developed pigmentation or melasma was always starting now doing so much cosmetics to hide it. So that was the time when it came to my mind that there is no treatment available. I'm talking of 1997. There was no treatment available to correct hyperpigmentation on face. We don't talk of complexion. Even black, dark, brown, dusky, wheatish, every complexion can look so attractive if one has a clear skin. So at that time, we went into so much R&D and everything. And this brand Bell Block started to correct hyperpigmentation. And I am glad to say that till now, it is working good on every lady coming to us with hyperpigmentation or any man. Now, hyperpigmentation these days has increased tremendously. The reason is now not only pregnancy, but even the medical abortion, because a heavy dose of hormone is given at that time, and that can lead to pigmentation. Also, our cosmetic procedures like women do scrubbing. A simple procedure of scrubbing can give you pigmentation. Scrubbing could be done by the scrubs, commercial scrubs, or at home by basin and choker and other things. So now, because scrubbing is a useless exercise, the shedding of dead cells is a natural process. But because it's a big commercial industry over it, so scrubbing has been advertised so much, it is so essential. No, it is not. Then second practices of putting so many other things like kachi sabziyan, kacha aloe vera, kacha papita, kacha tomato. Now, in sab mein, there may be a very small element of things which are useful for skin, but not the whole fruit. So all those things we have seen, because now we have thousands and maybe lakhs of people coming with hyperpigmentation, with the effect of that negative effect, which is playing on their psyche, and they are not able to lead a normal life. A person, हर लेडी की एक तमन्ना है कि उसे खूबसूरत दिखना, और जब तक कोई पलट के ना देखे वो मजा नहीं आता, राइट? सो अब जब वो धीरे धीरे वो घटती गई, अब कोई पलट के नहीं देख रहा, कोई बात नहीं करना चाह रहा, when you go to a crowd and there is no that wow factor is missing. So then the requirement of this correction was very important. internal beauty, external beauty, both are important. But I felt कि जो first image बनती है, वो external beauty से बनती है. Internal beauty comes definitely, but at a later stage. So both these things went simultaneously. And now I feel a woman which always has an internal desire to look attractive. So the word is now attractive. Beauty तो हर एक के पास है. किसी के कोई feature अच्छा है, किसी की कोई चीज अच्छी है.
Yeah.
Right?
Please go ahead.
So yeah, so this all together made me move on this journey of cosmetic gynecology, and now I see it is very, very appropriate that it all started. And now plus अब इस cosmetic gynae की जरूरत दूसरी क्यों पड़ी, especially the corrective surgical procedures, was because of the social norms. मैं अरब वर्ल्ड में थी, वहां पे कि लड़की वर्जिन होनी चाहिए. अरे जब लड़का वर्जिन नहीं है तो लड़की की वर्जिनिटी की क्या इंपॉर्टेंस है. बट नहीं, क्या उन लड़कों को ये नहीं मालूम है कि आफ्टर ऑल इफ दे आर हैविंग सेक्स विद unmarried other girls, so similarly there will be other girls who are subjected to the same problem, right? But when they want to marry a virgin. So ab ye jo hai, otherwise it is a very big taboo and stigma on the part of the girl. So ye sab zarooratein, which is social norms, just because we have kept false standards or double standards about ourselves. This was the need for those women, educated women, even doctors with me working in Arab world. They said, doctor, please ऐसा कुछ कर दो कि मैं virgin दिखूं. अरे भाई, अगर virginity lose हो गई है, तो how will you go and get it corrected? So please, you have to raise your this thing. But society को कोई change नहीं कर सकता overnight. Things have to go. The boys and the men and the women in the house, like the in-laws, they all have to understand कि अगर society या general norm of society is moving towards advancement or things like that, and the girls are now working outside also. पहले सब घर पे रहती थी, तो अब जब सब work करते हैं, then they are subjected to all the pressures around them, the peer pressure. How can you expect a girl to have this standard and your boy to have a lower standard? But then it is always like that. I mean, you can't help it. So of course, when people come to me, I do tell them कि भैया अपना mindset भी change करो. ये नहीं है कि ये सब चीजें तुमने आज एक बार correct कुछ भी करवा लिया, but you have to definitely change your mindset. Only then these things will reduce. Otherwise वो फिर बढ़ता जाएगा. और अब तो ब्यूटी के स्टैंडर्ड्स ही चेंज हो गए कि भाई लिप्स अगर इतने मोटे नहीं है तो वो अच्छे नहीं लगेंगे, जबकि हमें क्लियर दिख रहा है कि वो उस लेडी पे सूट नहीं कर रहे, बट फिर भी वो करवाए हुए जस्ट पीयर प्रेशर कि look, I also go and get the modern things done, though they are required, not required. So I think that's all. I've touched the most practical aspect of the whole subject.
Okay. Thank you very much, Dr. Neeta Rati, for enlightening all our viewers about the cosmetic gynecology, which is a very, very essential subject, because we know that practically it's every household is having the same problem where the lady faces after the delivery such type of situation when the marks post deliveries are always there, scratch marks and whatnot, and that's why this surgery is required. Thank you very much. I'm sure those who are watching our shows are also enlightening, and definitely they will be taking the precautions and consulting the doctors near to their place, so that they will not subject to any cruelty by a man anywhere, or even the mother-in-law, the sister-in-law, anyone. Thank you very much, Dr. Rati, for giving your views. Now, I would like to invite my next panelist guest, and she is Dr. Shama Rice. Dr. Shama is a clinical and cosmetic dermatologist with a fellowship in lasers and dermatosurgery from Singapore, besides several other international trainings in dermatology. She has authored chapters in Indian textbook of dermatology and cosmetic dermatology. Besides several other publications, she has spoken and conducted training workshops at several conferences. Besides working as a full-time consultant dermatologist with Kokilaben Dhirubhai Ambani Hospital for 6 years. She has worked with several clinics and hospitals across Mumbai. She now works full-time at her own Center for Clinical and Aesthetic Dermatology, Derma Hub. Welcome, Dr. Shama Rais, on our show. Dr. Shama Rais, you have heard our earlier panelist, Dr. Rajivanan in part, then Dr. Pallavi Rati, then Dr. Neeta Rati. Now, they have given their views about the women and beauty. We would like to know from you, your views on women and beauty. Dr. Shama Rais, please.
A very good morning to everyone. And first of all, I'd like to thank Dr. Goel and Dr. Anand for giving me this opportunity, because this is a topic I think which is very close to my heart. I have always been an advocate of the fact that beauty is not skin deep. Beauty, I think, to a very great extent, is almost synonymous with women. But of course, hopefully, with this extremely well curated panel that we have today, we can hopefully redefine the definition or the approach to holistic beauty. And I'm glad that most people here are on the same page. Skin, as we all know, is the largest organ of the body. But it is not an isolated organ. So skin is very well knit and very well integrated with your entire body's functioning, whether it's your hormonal system, whether it's your neuroendocrine system, whether it's inflammation or there's stress, or it's your sleep or it's your diet. Practically everything has an effect on your skin and on your hair. So really, to isolate skin and beauty from your internal well-being would not do justice to the field of dermatology, I would say, to begin with. I'm sure most of you, I'd like to keep this very generic because I'm thinking we have viewers from all age groups, but I'm sure most of you may have seen your acne or your pimples or maybe your eczemas flare during stress, especially now since we're dealing with this COVID pandemic. There is a lot of stress factors associated, and everyone is facing it in some way or the other. I'm not sure if most people know that there's a very well-established brain-skin connection. There is a lot of neuroinflammatory response that we see in the skin in response to stress and several mental triggers. So stress is something we need to learn how to cope with, which if people do not manage, it can actually show up in a lot of psychocutaneous disorders that we deal with. I can never overemphasize the diet. Most of the patients that we see for hair fall, I would say even 95% of the patients we see for hair fall is predominantly nutritional deficiency. We have a lot of diet fads that we follow. And of course, our Indian population being largely vegetarian, we see a lot of protein deficiency, vitamin B12 deficiency, iron deficiency, which eventually leads to massive hair fall. So again, it's a small part and we all know that diet is important, but if you're not eating well, say a good mix of fruits and vegetables of different colors to give you a good antioxidant, which will have an anti-aging effect in the long run, or when it comes to your hair, especially with different kind of diets, improve the protein intake, improve the iron intake, have good milk products, which is going to eventually help you to maintain better hair. I've never had a patient who has, for hair fall, who has told me that if I ask them, what is your protein intake like? So the most common things like, oh, I have a lot of protein. And what is a lot of protein? So I would like to use this platform to really put this point across, as hair fall is something we see largely as dermatologists, is that if your body weight is 50 or 60 grams, you need 50 or 60 kilograms, you need about 50 or 60 grams of protein intake in a day. And if you're taking one bowl of dal, it's about 6 grams of protein. If you're taking a piece of chicken or fish, it's about 20 grams of protein. So for all the people who come and tell me that I have dal 3 times a week, you're clearly not reaching your required protein intake for healthy hair growth. Diet is one thing. Like, of course, we've had a lot of our panelists already discuss. Sleep is extremely important. Sleep is the time your body heals. There's a lot of oxidative stress in the body because of your daily stressors and as an aging process. So sleep is the time your body actually heals and repairs all this. So again, sleep, diet, your stressors, these are important factors. Another thing is whether stress causes you skin problems or something as simple as acne, or acne causes stress. there's a very strange correlation between the two. If there are stress levels, pimples or acne is something we see routinely, and it's not just related to teenage now. We see a lot of middle-age acne, which is because of hormonal imbalance. So if there's stress, there's increase of serum cortisol levels in the body. Serum cortisol levels plus other hormones which get disturbed and cause pimples or breakouts. On the other hand, there are several studies which show that patients who are dealing with acne have about 60% of them have associated anxiety, which creates avoidance. They're trying to avoid social gatherings. It affects the social interactions. Eventually, which also affects their performance, maybe at school or maybe at work. Because in some way, it's about your self-image and your self-esteem. And pimples is something it just takes about 2 or 3 months for us to treat and get under control. So technically, even if it's something as simple as pimples, it has a correlation to your diet, to your stressful lifestyle, and your mental well-being. One more common thing that we often see in the OPD as dermatologists, and I'm sure all my colleagues would agree, is this whole fascination with fair skin. We often have mothers bringing their children, a child as young as 8 years or 10 years, and telling us that, she's really dark and can we do something about it? I think my heart really goes out to that child at that moment, because if you have said that in front of somebody else outside once, I don't know how many times you've said that at home to your child. And what you need to realize first, that you have actually induced or introduced that thought in that child, that the child is less in some way. You are actually, yes, you may have a slightly fairer child if you're going to go all out and do this, but you have already induced a little low self-esteem in which the child is going to feel that, oh, I'm not enough in some way. Not to say that we do not want to treat. Yes, it's important because it's your face is how you reflect and the way the world perceives you. And as dermatologists, we have several solutions for this. But I think it's also important that it should not come at the expense of having a lower self-esteem or lower self-confidence and not prioritizing to that effect, to that extent. Even if we are talking about color, like say, Indian skin is popularly known as the skin of color because we have a lot of melanin in the skin, which is a good thing because melanin actually protects us from skin cancers, as opposed to our Caucasian skin or the whiter skin where they're more predisposed to skin cancers. But of course, we do have an inflammatory risk of anything in the skin responds with pigmentation. Say it's dry skin, it's any kind of rashes or even dry pimples, winter season can make your skin go darker. I can completely understand, and you can have various, even simple over-the-counter creams with vitamin C, kojic, azelaic, which are safe to use to bring back your normal skin color. But of course, again, I think this platform is the best to reinforce the fact that it's not about glorifying very fair skin. We have very renowned gynecologists also on the platform who will vouch for the fact that we have polycystic ovarian syndrome as a big concern amongst the girls today. It wasn't so maybe a decade ago, but what is the reason? Again, it's an interplay of everything. It is your hormonal imbalance causing excess male hormones. We have women in the mid-30s juggling several roles. You're trying to run your house, manage your kids, manage your profession. So the stress levels are very high. Even if I'm going to do a laser hair reduction for, say, a patient with polycystic ovarian syndrome who's come with facial hair, the most and first important thing we do is do the hormonal profile to figure out at what level we want to block the excess male hormones before we laser. The lifestyle modification, their visits with their nutritionists, which will help to stabilize their hormone levels, reduce their acne, prevent their hair fall, preserve their hair because they have a female pattern hair loss also. So like I said, no matter which field of dermatology, whether it's cosmetic and lasers and pigmentation, or whether it's purely health related, I do not isolate dermatology or skin as a single organ. I think it's extremely well integrated, not just with other systems, but even the mental well-being. Like I said, we have a very well-studied branch of psychocutaneous dermatology. We have stressors which trigger skin problems. I have had people in my OPD, and as we all know that it is, nobody is going to want to commit suicide because you have a very resistant rash which is itchy. But I have people who wanted to have sat down and said that, doctor, it itches so badly, I just want to end my life. That itself, I think, is the biggest example. That rash would take me just about 3 weeks to treat, but probably somebody like this would need a psychological counseling, would need better strategies to cope with whatever stressful events that they're facing in their lives. So we as dermatologists can also have better results with their skin rashes. So yes, I think I could go on and on, but the only point that I would like to reinforce again, that even a healthy skin, whether it's just clinical dermatology or cosmetic dermatology, it's a reflection of a healthy mind and a healthy body. And even if you talk of something as simple as anti-aging, which may be considered very superficial for many, it is eventually boiling down to that 5 minutes of self-care that you can dedicate to yourself. This will probably decide what your skin looks like maybe 5 years from today. And yes, I think it's very important that beauty is not skin deep, and even dermatology, eventually we need to look at the whole patient as a whole. Thank you very much.
Thank you very much, Dr. Shama Rais, for giving your views and very good views about the skin, which is very, very important. And yes, in India especially, people wants to show that they are having a fair skin, which is a very, very wrong concept, but it is prevailing. And that is why so much psychological problems are there in India in the patients. And you rightly said that when the mother or the father says in front of the child that
Yes.
he is not fair and he or she has to be fair. So what type of trauma that child is facing, nobody can even think of that. But yes, now that the way the Indian medical sciences have advanced, the psychiatry, the psychologist, as well as the dermatologist, because earlier times these types of fields were not that popular and nobody wants to go to them. But now it is very much there. Definitely, I'm sure this will be again a eye-opener for our viewers, that what is required, one should understand. It's something which we should not go beyond that, because the science, medical science can improve, but that improvement is nothing in comparison to how much harm they have already inculcated in the daughter or the son. Thank you very much, Dr. Sama, for giving your expert views. Now, I would like to invite my next guest, and she is Dr. Shama Vibhakar. Dr. Shama Vibhakar, MBBS, MD, DDV. She is the founder and co-director of Skin and Scalp Clinic, Mumbai, the Center for Excellence in Dermatology and Laser Medicine, Plastic and Cosmetic Surgery. She was graduated from Grand Medical College, Mumbai. She is having 15 years of experience in dermatology, trichology, STD, dermatology, and laser procedures. She is author of 2 chapters in Textbook of Dermatology Surgery, 3rd edition. She conducted workshops in procedural dermatology. She was faculty in various national and international conferences on dermatology. Her keen interest is in preventive dermatology, female dermatological disorders, cosmetic dermatology, etc. Welcome, Dr. Shama Vibhakar, on our show. Dr. Vibhakar, you have joined late. I know that you are busy, but before that, all our panelists have spoken. Dr. Rajivanan has spoken, in not fully, but whatsoever he has spoken, I will just brief you that he was insisting, or he was emphasizing about the inner beauty, that the inner beauty gives the strength, and the outer beauty is also required, but the inner beauty is also very much important. Then Dr. Pallavi Rati, she gave all the details ki how the inner beauty at one time was very important, but how the time has changed. So once the time is changing, the beauty's definition is changing, and how the corporate sector, working women and a homemaker, they have different needs as far as the look wise is concerned, and how in India, up to what extent we require the surgery or the improvement on our skins in comparison to the Western country. Then Dr. Neeta Rati has given the details about the gynecology, how the cosmetic gynecology and how this scratch marks up post delivery and all those things were a very bad thing initially at one time, 40 years or 50 years back. But now, because of the technology, people are getting rid of this. And Dr. Shama Rais, I think you have heard her, so I need not to brief you. Now, we would like to know from you, the women and beauty, Dr. Shama Vibhakar, please.
Yeah, am I audible? Good morning,
Yes.
everybody.
Yes, please, go ahead.
Yeah, thank you for giving me this opportunity. And I think it's a great opportunity because I can reach out to a lot of people with my vision, and that is preventive dermatology, because that is what I practice in my clinic. So that is how I'm going to give this lecture, because we are 3 dermatologists on panel, and I see nothing which is left out with Dr. Pallavi and Dr. Sama. They have almost touched everything. So what I would like to focus mainly is how I counsel my patients. Just when the patient comes with any cosmetic or skin disorder, the first thing that I tell them is, to me, all my patients are beautiful, because each one has their own beauty, and you cannot compare yourself with anybody else in this world, leave alone actresses and the people whom they are really comparing with these days. Then I would ask them whether there is something that really affects them, and I would try to discern whether it is a thing which we need to cure, means it is a disease, or it is a disorder, or it is just something which the patient is bothered about. Now, when I see so many patients, the most common thing what I feel is that the patient says that somebody else told them that. And that is what we need to expressly make the patient understand, that it is not what somebody else is finding fault in you. It is what is affecting you, because you have to first believe that you are beautiful, number one. Secondly, if there is a concern, we need to understand whether it is a disease and which needs to be treated. And if it needs to be treated, then how much of it can be treated? So first thing I tell them whether it is an infection or not, because for me, that is the primary concern. And I make it very clear to the patients that it should be their primary concern. Most of the times it is, whether they want to know, they really want to know whether that disease is going to affect them and their family. So that is what they need to understand, that is this disease going to affect their family or not? Secondly, Dr. Lal, I just want to know that my video is not showing up.
No, you are, we are very, you are very clear. No problem.
All right,
we can see you.
All right. So this is what they need to understand, that whether it is a disease. If it is a disease, we cure it and we can have a timeline. But if it is not a disease, like there are something like melasma, which is a pigmentary disorder, then there is something like vitiligo, which is again a pigmentary disorder. And then there is something which aging, because we are aging every day. So you cannot call it a disease. Okay, we cannot even call it a disorder. It is something which is just there. It is a part of our life. So we need to explain that to the patients, that these are the things we will be able to cure, and these are the things we will be able to help you with reducing and maintenance. So that is when the patient becomes completely prepared to accept the treatments as well as the timeline which goes with it. Another thing what they are prepared is they're equipped to answer the questions to those ones who are close to them, who are probably putting in a lot of pressure, especially peer pressure, family pressure, like Dr. Neeta rightly said, and Dr. Sama also said. So they will be themselves equipped to answer these questions, and they need to reassure themselves. And that may not happen at the first consultation. It may be a repetitive thing that they need to, need to reassure them, and they need to reassure themselves that this is going to take time. It may not go away completely. And we are here to hold your hand and help you and reduce and keep this disorder under control. So this is how I deal during consultation with my patients. And I fully equip them with all the information required for any treatments. Most of the patients go to Google and they go to multiple platforms which are totally thrust on them. And I believe what my professor once said, that eyes your brain does not, your eyes don't see what your brains don't understand. So patients are not qualified to understand whatever Google is telling them. So they land up on sites and on information which is totally baffling and which is scary. So most of the times we are actually pruning out that information and we are making them understand what is right and what is wrong, and what people go and see YouTube videos on tree self cure, and they do all these sort of things. So on this platform, I would like to exhort the patients and everybody that please do not blindly follow things which are shown online. Please take opinion of a qualified person. If it were so easy to get treated online, we wouldn't be spending 8 and 15 and 20 and 40 years in getting experience and in learning these things. Don't play with your skin. Do not play with your body. You are the one who is going to lose, not the person who is showing that YouTube video. Another thing is, in pigmentation, in fungal infection, people are using steroid creams. There has been so much loss of money, efforts, and there has been so much increase in fungal infection which is resistant to treatment, because patients are buying creams directly from medical stores or online, and there is no control on sale of such creams. From this platform, I would like to inform when this change happened, why this change happened, and why the creams which were being used before suddenly have become monsters. That is because there is a change in the molecule. A cheaper molecule but a stronger molecule has found its way in mixture creams, and that is why they no longer are so mild. They are very strong creams. They are giving rise to thinning of the skin. They're giving rise to cholangioectasias, redness, hair growth like hirsutism on the face, sensitive skin, and very large striae involving all over the body. I have seen young girls, 15 years, 14 years of age. They have seen YouTube and they have applied steroid creams and they have striae all over the body. And when these girls, they come to me for treatment, the first thing I feel is that I need to bring the skin back to normal. And in bringing it back to normal, I just have to first stop everything, just allow the skin to settle down. Sometimes they are not willing for that time, they are not patient. So say they jump from doctor to doctor trying to find a cure. So I just want everybody to understand that doctors are not gods. Whatever you have spoiled, you need to understand that you need to give them a chance to help you out. If you do not use creams without prescription from qualified doctors who are supposed to be prescribing those creams, then you need to let the doctors take things in their own hands and just have faith. We have over the few years lost faith in our doctors, and that is really backfiring on our patients. So I want to tell everybody, please have faith in the doctors. They have spent their very prime years of their lives in very deplorable conditions, trying to learn the science, which is difficult. They are the topmost minds of our country. Give them the respect. Let them handle your case. Have faith. Don't lose faith in your doctors. Which is every day we are seeing doctors being beaten up. It is not just surgicals and ICUs. People have become so impatient because they want urgent cures which are not possible. Plus, most of the cases are getting complicated because the patients are taking treatments in their own hands and getting treated by unqualified quacks. And then they go to qualified doctors and expect them to give them miraculous results. It is not going to be possible. Sorry, I digress from the topic of women's health, but this pressure of society is what is causing so much pressure in all fields. I feel the pressure in my own clinic to deliver results, right? And that is because of everything needs to be treated very fast, and that is not possible. Your inner well-being comes with yourself, you yourself being happy with your skin, with your body, eat right, do exercise at least 3 times a week, go for a walk for an hour, you get your me time, you get your oxygen, you get your vitamin D. Don't shy away from sunlight. Our skins can handle it if it is taken at the right time. Don't go out in peak sunlight from 11 to 3. Don't go out because that is the time when you will have allergic reactions to sun, when you will have photopigmentation. But do go out at between 7:30 to 8 in the morning. Just now it is a lockdown. Make use of it. Exercise, eat healthy, don't eat junk food as everybody says. There are a lot of preservatives and coloring substances which are coming in junk food and processed food. Beware of them because they give rise to allergic reactions. They are also known to cause cancers. So our good old Indian tradition of making food at home daily, morning and evening. Our parents, our mothers are spending so much time, whether they are working, whether they are not working. They are practically trying to cook meals for us. And I think that is, in fact, that is so good that we've been brought up this way. Keep it going. Don't let it go, right? And when you're working also, make sure you change your position, make sure you drink a lot of water, make sure you take a walk a bit, and that will help the blood circulation go on, and it will help you to feel better every time, right? And in such times of lockdown, I feel you're giving a nice chance to nature and you're giving yourself time that you really needed to exercise and eat well. Utilize it. Don't see the negative parts. See the positive aspects of this whole thing. We are just being rebooted. And as per skin is concerned, everything has been covered. Just that a regular cleansing, moisturizing, and if required, a sunscreen application as and when you are going out. You don't need to apply sunscreen daily. You don't need to apply makeup daily, but yes, you need to cleanse your skin. If you are in a field where you are going to apply makeup daily, make sure you remove it with a baby oil or a good cleanser with a micellar water or whatever your suits your skin for oily and dry skin types. Take help from your dermatologist. Do online consultation if required. And make sure you moisturize. And when you're drinking enough of water, having sprouts which have a lot of vitamins, lot of good food, colored fruits and vegetables, they are the best for your skin. Everything that's colored. Antioxidants, which you need not pop pills. You can take pomegranates. You can take avocados, you can take sprouts. They have a lot of antioxidants. People with acne, they need to limit their milk usage because there is hormones in milk, right? And they need to reduce their substances, anything with oil and lot of spice. In the heat, reduce your red meat, reduce your spices. People with red skin and rosacea, reduce your spices, reduce your tea, coffee intake or caffeine intake. All that will take care of your skin hydration. The more caffeinated drinks you take, the more your skin gets dehydrated. If you're working in AC all the time, make sure you moisturize yourself and drink a lot of water. Ask your doctor that what is your good diet according to your work profile. If you're in the sunlight, if you're in the AC, if your work timing, share your work timings with your doctor, share your diet with your doctor. I'm sure they're going to help you out. So all these are going to make a lot of difference. And I feel inner beauty is the only outer beauty, and we need to take care of that.
Thank you very much, Dr. Shama Vibhakar, for giving so much details. Two important points which she made is, one is that avoid junk food, have the homemade food. And we have seen in this COVID time last year that our mortality rate is low because of our mother, grandmother, homemade
Exactly.
food. And that's
Exactly.
what the doctor has mentioned. And another which is very, very important point is, whenever you are going to a doctor, please have full faith on him or her. Don't
Exactly.
try to do something which is unsocial, uncivilized. After all, they are not there to harm you. They are there to serve you, and they want to save you. But if you think that they are just your enemy, it is a wrong concept. Thank you very much, Dr. Shama Vibhakar.
Thank you.
Paucity of time, so I would not like to give more summarization of your talks, but you have given everything, so I need not to summarize again. Now I would like to go to Dr. Rajivanan. Thank you very much, Dr. Shama. And now I'm going to Dr. Rajivanan. I'm sure now his net will be working. I'm asking a very simple question, Dr. Rajivanan. You have heard everybody. Why women always wanted to look beautiful to attract her husband? What about husband?
Yes.
They also have the same mentality that they want to look more handsome so that they to attract their wives or someone else. What is your experience? You are getting so many people as a in your clinic and otherwise also. What you say about that?
Mr. Lal, I'm giving you an answer which may begin in a different way, but which would come back to what precise question you have asked.
But only thing is you have to be brief. Yeah,
I'm brief.
Yeah.
Women are inherently beautiful. They are inherently born beautiful. Even 95-year-old woman can be beautiful. One thing which in a very brief way, I'm explaining it to all women viewers, their own mind is their own biggest enemy. Mind is their biggest enemy, mind of their own, as well as of thousands of the people around. Save yourself from the mind which compared with others or which accept the criticism or the comment by others. If you can learn to be in this moment, if you can learn to be totally in this moment, and if you can learn to be spontaneous, heartfulness, mindfulness, just be spontaneous, just be in this moment, your husband would never fall out of love with you. He has married to you not because of external attributes or figure. He is married to you so that you can help him get out of his mind and connect to your heart. And that's the beauty which is unmatched, unparalleled anywhere else with anyone else. Go ahead. Mr. Lal, please, over to you.
Okay, thank you. But you have avoided my question. My question is very clear. Why the husband is not making himself more handsome to attract his wife? Rather, he always have the more handsome. He wants to look more handsome to attract others. Anyway, thank you very much, Dr. Rajivanan. Next time, definitely, I'm not going to leave you like this. Now, my question goes to Dr. Rati. Dr. Rati, being a gynecologist, and you know the ladies' problem well, women in menopause stage suffer from severe hair fall issues. How can they control this hair fall, or what preventive measures do they take to control such hair falls?
Yes. Now, hair fall basically, though of course it has become a more common problem because of the recent practices of giving colors to the hair or doing straightening of hair or coloring of hair or curling of hairs. So, well, at certain ages in life, the hormonal changes or the fluctuations are a little high, and that could be reason for hair fall. The second reason, which is becoming more popular these days, is of course the different cosmetic practices which people do. So all those things. Now, how to correct them is of course to make yourself healthy from inside and outside, which has already been stressed so much on the talks here. To have a good diet, number one, and to use the natural practices more as compared to the artificial things, and also to avoid going to too many parlors for getting this hair fixed is another thing, and also to keep the hairs clean. I mean, like we need to take bath every day. Similarly, the hairs also need to be cleaned every day. So that is there. And of course, at the perimenopausal age, when the female hormone is going down, there is a relative increase in male hormone at that time. Though it is not increased as per the lab reports, but relatively, there is a difference. There is a fluctuation, estrogen going down, the male hormone is predominant. And male hormone has definitely the DHT is this area of the scalp, which is like top area, is sensitive to that hormone. So if there is a relative increase, there is chances that the hair fall may increase at that time. But I have seen that if we use certain natural things like henna, right? Then there is methi dana. Methi dana can help you sort of protect your hair from falling, which we have practiced. Even I have practiced it and I've seen it's very good. Then amla, certain things when we use for our hair, and because people don't have too much of time, we have developed oil out of it, all these natural ingredients called as root active. So if that is used on a daily basis, no lady, no men will go bald. That is a guarantee from our center to the public who's using it.
Okay, thank you very much, Dr. Rati, for giving your views. Now my question is to Dr. Rati, Dr. Pallavi Rati. So many beauty parlors, every hook and corner, the beauty parlors are there, and they are headed by somebody trained 1 month, 2 month, 3 months course here and there. Don't you think that the beauty parlors are promoting quackery, and that's why these all problems, which because there is no dermatologist, no trained doctor or qualified person, is happening? And tomorrow it is going to become a very, very big issue, like we have seen in a medical science, how the big issue that everyone is doing the practice, and it has given a very bad name to the medical science. Don't you think this is also going to be a very big problem? And it is, that's why this is more and more skin problems and others are coming due to the quackery in beauty parlors. What you say about this, Dr. Pallavi Rati?
Yeah, I think, Mr. Goel, you have touched a very, very important topic here. This is something which is very important that our viewers should come to know, that beauty parlors are promoting quackery a lot nowadays. Since this industry is something which seems to be very easy, everybody wants to plunge into it. But that's not something which should be taken into. We have spent many years and our experience into this, understanding the side effects, understanding your skin, and understanding your hair. A 2 or 3 months course can never do justice to your skin. Your skin, as the largest body organ, it reflects many things which the eyes of a beauty parlor person might not be able to see. As I think Dr. Shama had already said, that what your eyes sees is only what your mind knows. So this parlor people might not understand the integrity of some pigmentation, something, and they work at your skin with some chemicals, with some bleaching agents, which might cause a lot of harm to your skin and could be permanent. Using steroid-based creams is also very commonly seen. Many times I've seen people coming with some creams and some choti dabbis and some this, and they are using it, very popular, and they feel a lot of fairness coming out of those creams in just 7-8 days, and they just become addicted to it. This addiction can lead to a lot of problems, because the moment you stop these creams, there is a side effect. There are multiple other issues which come up: hirsutism, excessive hair growth, excessive acne, sensitive skin, everything comes up. And then they end up to a dermatologist, and they want them to treat in a couple of months, which becomes impossible for us to do, because we have already done a permanent damage to your skin, and now we can't rectify it completely. So please do not play with your skin. Be in safe hands. It is very important to identify the right doctor for you, the right board certified dermatologist for your skin, and then address your concerns to them. They are the right person who will guide you throughout your skin, throughout your life, if you need any help, even if anything goes wrong with the products you are using. See, skin is a very, very sensitive organ, and it has to be treated well. You don't allow any hairdresser to cut your hair just because you love your hair that much and you want only that particular hairdresser. You can't just go to XYZ and just ask them to cut. You don't ask your family members to cut your hair, just trim my hair and do that. You don't do that. You go to a hairdresser. Similarly, it is a dermatologist domain, and let them handle it. They will take good care of your skin and your hair. And this is something which I would definitely let this platform be used for this, that we are not going to go with any XYZ creams which do not have any labels.
Okay.
Most Facebook, social media have this bombarding that this cream, this oil is going to give wonders. This is going to give 7 days results or buyback or something, guarantees and all these things. Do not fall prey to all this.
Okay.
Thank you.
Thank you very much, Dr. Rati. Paucity of time, but still one minute each. Dr. Shama Rais, you mentioned about the skin, but now in the COVID time, everyone is wearing mask. And there are reports that the masks are also harming the skins, overuse of masks or substandard quality of masks, or the mask which they are not washing and they are wearing for weeks and months together. What you say about this? And one more, just for my own knowledge, skin transplant can remove those marks or some spots which are already in your face. Can it be done through the skin transplantation, like in which is very it's not prevailing for beautification, but it's prevailing for the burn cases. But I'm asking if anybody wants to get their face, can the skin transplant is a solution?
It depends. I'll answer the skin transplant bit first. It's a shorter answer because it is depending on the scar. So if you're talking about a mark like an acne scar or a chicken pox which leaves a small scar, so those you have largely two treatments. Either we could do a surgical excision, so you're trading a big scar for like a fine surgical line, which can be improved with a laser, or there's simply acne leaving scars, then they could simply be lasered or microneedling radio frequency, which gives a good result. When we're talking about burns, of course, you will need plastic surgical corrections. But very important here is because patients always think plastic surgery or skin transplant means no mark. It's just trading a bad scar for a good scar. So any surgery will have a scar that will be there.
And about the mask?
Yes. So basically, of course, that's very true. We're seeing a lot of problems associated with the mask. Mask acne is the most important. So you have three types of masks that people usually wear. That's your surgical, 3-ply disposable mask, fabric mask, and N95 mask. A few tips that you can remember to avoid these is if you do not have exposure, because now we are peaking again, and like how, if you don't have exposure to too many people, you can do with a 3-ply surgical mask. It may not give you the best protection like an N95, but it doesn't cause occlusion of the skin and breakouts or sensitivity of the skin. You must dispose it. Disposable mask should not be reused. Fabric mask, you must wash it even if you're using only for 2 hours. To keep a couple. The minute you're back, even from infection point of view, re-wearing the mask causes higher risk of COVID infections. So it must be put into washing straight away. Use fabrics which are soft on the skin, not harsh and not fancy. That, fabrics which don't run color, because that could again sensitize your skin. And N95 mask, of course, for the medical fraternity, largely a lot of occlusion because they have to be tight to give you protection. So what you can do is use a salicylic acid-based face wash, which helps to remove your dead skin, and use an adapalene or retinoid cream by the night with good hydration in the morning. And when you wear the mask, don't use any creams or sunscreens beneath it. So these will help to minimize.
Okay, thank you very much. Paucity of time. So last question to Dr. Shama Vibhakar. Please unmute yourself. Can we control aging? You mentioned about aging. It's $1 million question or $1 billion question. Everybody wants to control the aging. Is it possible with the new technologies?
First, my question is, why do we want to control aging? Do we want to just stay 20?
No, somebody wants to live for 200 or 300 years.
Yeah. So if you want to live for 200 and 300 years, so is the society worth living? Are the living conditions worth living for 200 and 300 years? The food that, see, I'll tell you, my great-grandfather lived 100 years. My granny is 90 right now, okay? They've had the best food, which is not polluted. They never had factories near the farms.
Dr. Vibhakar, we have already heard about the food. I just wanted to know whether there is because there was a media report that one billionaire has spent so much money to see to it that he will remain alive.
I would like to give you example of Michael Jackson.
No,
okay. He tried to do a lot of skin surgeries to change the color of his skin only, and a little anti-aging effect, and he landed up with cancers.
Okay.
So if we are trying to go against nature, the law of nature,
we got the answer. Thank you very much, Dr. Shama. Sorry for that, because the time is short. So today you have seen that it's not the question of inner beauty or outer beauty. It's the question of that ultimately the pride of a woman, and the pride of women is inner beauty as well as outer beauty. The society is such. The men are such. We want to see the beauty, outer beauty. We are not interested to see the inner beauty. But there are many ways now. So the women who have lost their self-esteem, they can definitely get their esteem back by consulting a proper doctor, a dermatologist, not to a quack. Don't try to get yourself, your skin touched by anyone who doesn't know the science of this. So that is the message which has come. And one thing is very clear, that husband always wants to look handsome for others, while wife wants to look beautiful for their own husband. Thank you very much for joining us. And today's program, which has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon se Samvad Saroka News, as well it was shown live on Facebook and YouTube. And our endeavor is to bring to you every day a new topic. And tomorrow our media conference with Lal Goel at 10:30 a.m. The topic is role of youth in controlling COVID. And our chief guest is Dr. Rashmi Kundapur, Additional Professor, Department of Community and Family Medicine, All India Institute of Medical Science, Hyderabad, along with 7 youths who are joining and giving their views. So please do tune in tomorrow for media conference with Lal Goel at 10:30 a.m. Thank you very much, Dr. Rajivanan. Thank you very much, Dr. Rati. Thank you very much, Dr. Pallavi Rati. Thank you very much, Dr. Sama Rais. And thank you very much, Dr. Shama Vibhakar, for joining us. And thank you all the viewers for
Thank you so
listening.
much.
Such an enlightening talk today. I'm sure that everyone will start giving more respect to their own women at their home. Thank you all.